Hi, my name is Jessica Wobu, and I'm working to eliminate health disparities in America through a nonprofit organization I'm starting called the Health Equity Coalition. Our country has an unfortunate heritage involving years of inhumane treatment, systemic racism, and other malpractices that have misconstrued the practice of medicine in this country, which has led to Black and brown patients not being treated as often because of fear and distrust or as effectively because of implicit biases compared to their white counterparts. In 1989, my grandmother unfortunately passed away as a result of cervical cancer, and she was only in her 60s. But before she was diagnosed, she refused to go to the doctor until her symptoms were so debilitating that she couldn't perform everyday activities and was finally forced to see a provider. When she met with that provider, they let her know that she was in stage 4 cancer and that the cancer had metastasized to surrounding organs. They recommended aggressive treatment, but my grandmother refused it and decided to accept her lot in life. And I remember crying and thinking to myself, if only she had been treated sooner. A few years ago, I watched a TED Talk by advanced practitioner Cheryl Whitaker, who described a situation that was almost exactly the same as my own. Crazy. Except it wasn't a grandmother, it was an aunt who had passed. And through years of research in Black communities, she discovered that African Americans have embedded fears about going to see a provider. And in cases when they have interacted with the provider, they felt misunderstood, unheard, and inaccurately treated. If my grandmother and her aunt trusted our healthcare institutions, they would have seen a provider. So my goal is, if we could resource a new generation of healthcare providers with the tools for lifelong learning and cultural competency, every patient would trust our institutions. They would get treated more effectively. Moreover, the billions of dollars that we lose every year due to implicit bias could be reallocated to fund the lifelong work of training our workforce, deploying workers to underserved populations, and advocating for the effective and equitable care for all people. The Health Equity Coalition exists to reduce health disparities in the United States by reforming the next generation of healthcare through advocacy, education, and outreach. The goal of advocacy is to form a partnership of individuals and organizations committed to creating and posting relevant content on social media, completing current research on health disparities, and going into the community to further catalyze the movement towards social change. Research confirms the effectiveness of grassroots movements in facilitating social change. The more people who rally together, the more changes can occur in policy, systems, and government. Right now, the Health Equity Coalition has reached out to over 3 organizations locally to establish partnerships and to commit to a goal of creating content, completing research, and catalyzing the movement towards health equity. The goal of education is to teach nursing educators how to effectively incorporate cultural competency into their pre-existing nursing curricula. Research states that undergraduate nursing programs that included focused discourse and discussion questions on health disparities and included 1 week of an immersive cultural experience increased nursing students' cultural competency and sustained it for several years following their learning experience. Right now, the Health Equity Coalition is reaching out to nursing professors, department chairs to present research and to propose a simple, free, and socially beneficial strategy for incorporating effective and sustainable cultural competency education into undergraduate nursing curricula. The goal of outreach is to mobilize a team of providers, social workers, advocates to bring healthcare to the services or to underserved populations with limited access or disabling fears about healthcare and healthcare providers. Right now, the Health Equity Coalition is strategizing and building a list of passionate and qualified healthcare workers, social workers, and community advocates to engage in outreach. Over the next 5 years, the Health Equity Coalition plans on having a fully functional team of participants engaged in outreach, as well as growing a fund to build a mobile health clinic to enable more specialized healthcare services to underserved populations. The Health Equity Coalition is a threefold organization, and therefore we will produce 3 sets of different products. Through advocacy, we're going to create relevant content, artwork, current research, and a functional network for advocates to connect on. Through education, curriculum for simply incorporating cultural competency into nursing education. And through outreach, a team of qualified participants to go into the community and provide healthcare services. Over the next 2 years, the Health Equity Coalition will refocus their efforts on impacting undergraduate nursing education by providing specified curriculum that can be seamlessly incorporated into their pre-existing curriculum. The Health Equity Coalition will also facilitate in-person culturally immersive clinical experiences in community health centers to equip undergraduate nursing students with the lifelong tools for treating a diversity of patients. Our greatest goal as educators is to help students see, to think, and to listen. Many undergraduate nursing students have not been exposed to individuals from other cultures, backgrounds, or socioeconomic levels, let alone be able to treat them. We want to provide them with that learning opportunity and assure them that the one most important element of being a successful nurse is compassion. Right now, the Health Equity Coalition is working to develop a website that will serve as a resource hub for health advocates across the country to interact with one another and provide the most up-to-date research to begin the process of reforming nursing education. We are also creating a short-form resources, including blog posts and social media content, in order to build a community of advocates and supporters online with a united purpose to reduce healthcare disparities in the United States. However, I can't do this without your help. Please partner with us. Your resources will help us fund the development of a website, the production of online content to grow a community through social media, and start a fund towards deploying our first, hopefully of many, medical health clinics. Together, we can change the face of medicine and reduce health disparities in the United States.